This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hey, Rational Wellness Podcasters, thank you for joining me today. And we've got a very interesting topic. We're going to talk about men's health. And in particular, we're going to talk about erectile dysfunction, which is a very important topic. By the way, everybody who enjoys this podcast, please go to iTunes and give us a rating and review. That helps more people find out about our Rational Wellness Podcast. So erectile dysfunction is defined by the Mayo Clinic as the inability to get and keep an erection firm enough for sex. Erectile dysfunction affects quite a large number of men in the United States. The long-term results from the Massachusetts Male Aging Study reported in 2000 an overall incidence of erectile dysfunction of 26% among men in the United States, with the rate of erectile dysfunction increasing with increasing age. There's approximately a 12.5% prevalence at age 40, 29.8% at age 50, and 46.4% at age 60. Besides age, the prevalence rate will also increase due to lower education and increased rates of diabetes, heart disease, and hypertension. Psychological factors can also play a role. Erectile dysfunction is a side effect of many medications. Poor diet and lifestyle, fatigue, excess alcohol are some of the other factors that can play a role. And to help sort this out, we have Dr. Geo Espinosa, who is the go-to guy in the functional and integrative world on men's health. He's the director of the Integrative Urology Center at New York University Langone Medical Center. He's a licensed naturopathic doctor. He's a licensed acupuncturist, a certified nutrition specialist, and a registered herbalist. And he's the author of Thrive, Don't Survive, Dr. Geo's Guide to Living Your Best Life Before and After Prostate Cancer, which is an excellent, informative guide to prostate cancer. And he's one of the editors of a new book on integrative sexual health. Geo, thank you for joining me today.
Hey, thanks so much, Ben. It's a pleasure.
Okay, so how should we get started on this topic?
There's many places to go. But it's very important to understand, first and foremost, that the penis is a barometer to a man's health. I every time I talk about this topic, I say the same thing because it's really important for everyone to understand. A man who does not get an erection for 3 months, whether it's because they don't have a partner or because they don't have a morning one or morning erection, that's a health problem. And that needs to, other factors might be that need to be investigated. So it's not only for pleasure, which is a very important organ for pleasure, but it's very important for just overall health.
Right. And what are some of the causes of erectile dysfunction? What are some of the most important ones?
Many of the causes are, it could be neurological. So anything that interferes with three things, right? The nervous system, a problem with the nervous system, okay. A problem with blood flow, or hormonal. Any three problems can interfere with either the nervous system transmitting neurons to signals to the penis, or blood flow can cause an erection. So, of course, there's things like multiple sclerosis, and sometimes surgery from prostate cancer can cause it. Particularly if they serve the nerve of the nerves of the pudendal nerve that goes into the penis.
What's the actual numbers on that? I've heard like 50%. Potential
minimum after a prostatectomy. Yeah, after prostate cancer surgery, minimum 50%. It's more towards 60% of men that actually get an erection. Men that actually get erectile dysfunction from these treatments.
Okay. And how much does getting the robotic surgery decrease that percentage?
How much is getting what? I'm sorry?
Robotic surgery versus the open surgery. Is the robot, how much does the robotic
Yeah.
surgery, decrease the likelihood for there to be, because that's one of the big selling points of it, right?
Well, it depends if you ask a robotic surgeon, because many of them would probably argue that it's it's very low rates. Actually, there's very little change in both urinary incontinence and erectile function or dysfunction with men who undergo robotic surgery versus open surgery. So there's very little difference. There's almost no difference.
Wow.
But you never want to make a decision. Yeah, you never want to make a decision of whether or not you will undergo robotic surgery versus open based on whether or not you can function afterwards. It doesn't make much of a difference in that regard.
So you've really popped a myth, because I think there's a very common perception that the robotic surgery is much safer. And
yeah, the company that creates the robotic machines and all the gadgets for the machine is called the Da Vinci Company.
Yeah.
Like Leonardo da Vinci. And their marketing has been outstanding. And that their direct-to-consumer marketing has been outstanding, to the point that everyone asks for a robotic surgery these days, and they think they'll get a better result, but that's not necessarily true.
Interesting. What kind of a reasonable alternative is doing radiation or radiation seed in terms of sparing, the nerves? Is that
radiation also can damage the nerves of the. It depends what kind of radiation, right? There's different kinds. There's external beam radiation that radiates the whole pelvic area.
Right.
There's more focal radiation, something called cyberknife now. That's proton beam radiation. That's more focal. That can save the nerves a whole lot more than external beam radiation. Sometimes men need both. Sometimes they get a radical prostatectomy, and let's say the physician saves the nerves of the penis. That can happen. But sometimes they need radiation afterwards, and it makes it almost 100% impossible to get an erection after that.
Yeah, one of my patients had, he was told originally it was confined to the prostate, to the gland, and when they went in, they found out that it had broken through the capsule. So then they subjected him to 60 sessions of radiation. Unfortunately, there wasn't any sign of the cancer. So I question what they were radiating, just the area around it.
They're radiating blindly sometimes, thinking that there is or will be cancer cells somewhere around the pelvic area, but they won't know exactly where. So they radiate blindly throughout the whole pelvic bed.
How effective do you think that is for decreasing?
Well, the reality is that the recurrence of prostate cancer after all that can occur up to 50% of the times. So you go through all that, and up to 50% of the times you can have a recurrence of your prostate cancer. Not to mention that after radiation, you can have secondary cancers like bladder cancer. And that's been, that's in the data. So it's, it's a fine line between what you think can keep you living longer and the quality of life that you can live while you stay living longer.
Right. Okay. So in terms of the vascular supply, the blood flow to the penis, really in this case, we're talking about, this is another barometer of your overall cardiometabolic health, right? So if you're going to have blockages to the arteries, to your heart and your, and your coronary arteries, you're talking about the same type of situation that's going to decrease blood flow to the penis, right?
Absolutely. you want to make sure that you want to make sure that the vessels are not atherosclerotic. So the penile vessels are very small. They're much smaller than other vessels, particularly to the heart. So things that can happen to the penile vessels can certainly work its way up and eventually happen to the heart vessels. So you want to make sure that the vessels are nice and supple, like all your vessels, not just the vessels from your penis, so that they expand and dilate and constrict. Dilation of the vessels of your penis is what gives a man an erection. Then the venous level closes in so that the blood stays in there until a man gets an orgasm. Then blood flows back into the system. They're having clean blood vessels is the name of the game, along with a clean nervous system as well.
So what are some of the tests that you would do with a man who had erectile dysfunction and you wanted to see if vascular issues were a problem?
Ben, there are no objective tests for that, really.
Okay.
There's one of the better, as a practitioner, I think you'll appreciate this. I still get 80% of what I need from a good physical exam and asking key questions, right? And that cannot be overlooked to try to find a fancy test. So then if we have all these tests, it's our purpose. So along those lines, there's the sex inventory questionnaire called the SHIM, SHIM, which you can download, anyone can download. And that's still one of the best questionnaires, is a sexual inventory questionnaire that it can quantify the issue, and you can put them on a protocol and then give them another SHIM score questionnaire 3 months after or 6 months after, and you can see the difference if they're improving or not. So there's no objective test at this point where we can measure, nerves going to. There's actually an old test that you may not be aware of, or you may, where if you insert you can do it yourself or do it to a patient. Insert the tip of your finger in the tip of the anus of the patient or yourself, and then if you squeeze the tip of your penis, you can feel the tip of the anus tighten at the tip of your finger as you press on the tip of your penis.
Okay.
That's an indicator, if that makes any sense.
I couldn't hear the last part. It's an indicator of what? Of neurological or?
Neurological health of the pelvic area of the penis.
Okay, so, I just got to turn the music off. Somehow it popped on in my office. Okay, good.
Okay.
Yeah, I never heard of that one, but that's kind of interesting. Yeah, I like to run those advanced lipid profiles and take a look at, all those factors and then try to change their nutrition to balance those things out. So, as far as
you want to rule out metabolic.
Right. So diabetes, obviously, blood sugar problems, hemoglobin A1C, inflammation, which is going to increase the likelihood. Right. What's your favorite way to measure inflammation? Absolutely. Do you use HSCRP to measure inflammation?
I do.
Yeah.
Okay. I do HSCRP. That's the main form of measuring inflammation. I use hemoglobin A1C, fasting glucose, and I use the NMR lipo profile as well. That has an insulin resistance marker there that I find valuable.
Right. I like to look at also the omega-6 to omega-3 ratio as a inflammation marker, and then try to modulate that.
Excellent.
Yeah. We've been.
What labs do you use for that?
We've been using the cardiometabolic lab, the cardiometabolic test through SpectraCell. It's a really nice test, and they're offering it at a really reasonable price for a patient with insurance. It's like $50. and it includes all the
Oh,
particle
great.
size, homocysteine, CRP, omega-3. It's a neat test. I'd look into that. So when it comes to neurological problems, besides
Oh, nice.
prostate surgery, I know as a chiropractor that problems with lumbar discs or nerve injury that can affect the nerves from the lumbar spine can affect the ability for erection. Isn't that correct?
It is correct. Absolutely, it is correct. Um, certainly as a non-chiropractor, I do find value in those lumbar adjustments that you guys do, just kind of opening things up for my male patients. So I get them to get adjusted as well.
Yeah, yeah, and we get patients who find that when they're having an issue with their lower lumbar region, sometimes they'll get pain into the testicles or pain into the groin, and so we know that it can have an effect. And
Yeah,
diabetic neuropathy, that can be a factor as well, right?
absolutely, absolutely. Yeah, anything anything that that contribute to any type of the metabolic type of syndrome presentation, high lipids, high blood glucose, big waist size, all those things are contributing factors. Then you have the hormonal aspect. That's very important as well.
Right.
And we can segue into that if you want, or we can
Yeah,
pause if you
sure.
want.
Let's do that. So what are the hormonal
Yeah, so
factors
the hormone.
that you like to look at the most?
So, we look at how well, testosterone is a major hormone, not only for sexual interest, but sexual function. Interestingly, infrequently, I find men that say that they can function with lower testosterone levels in the 300 and 400s. That's not too common. Oftentimes these guys say that they don't wake up with an erection. So waking up with an erection, or at least you recognizing that you have one, is actually a very important thing. It doesn't have to happen every day, but every now and then you should be able to say, hey, I woke up with an erection. The morning woody is a healthy thing.
How much does free testosterone versus total testosterone matter? How much importance are given to each of those measures?
So that's a great point. So, I had a patient today with a total testosterone of 486 and a free testosterone of 7.2,
Wow.
which was that's very low free testosterone. Well, it's very low total, and it's very low, but within normal range, is a wide range, and it's very low free. So that's very important. If you don't have free testosterone, it won't work. When it's bound to sex hormone binding globulin, that testosterone is not free to do what it's supposed to do. So it's very important.
So how would you treat a patient like that?
Well, I tell you what I don't do, and it's not that I'm against it, is that I try to have the patient make the amount of free testosterone that they need as naturally as possible. So I don't do exogenous testosterone. Again, it's not that I'm against it necessarily. I think for some patients is the right thing, but they become so dependent on it that their body just shuts down from making it. And it's very difficult to get them off it once they're on it. So what I do is, there's two things that I do. Number one is if they have erectile dysfunction and it's associated with poor hormone or low free testosterone, they want to function as soon as possible sexually. So that functioning sexually is more important than health to them. It's just the way it is. So I don't mind that they use a low amount of PD5 inhibitor, whether it's Cialis, 5 milligrams, very low dose, or 25 milligrams of Viagra. Again, a very low, that's the lowest dose that they have. I get them some extra nutrients that I use. I use a supplement called, it's my formula, so I don't want to sell on your podcast, but it does have L-citrulline.
No, feel free to
and
mention
epimedium,
it.
two things that are
It's
really-
your Mr. Happy formula?
It's Mr. Happy, and this XY Vigor, XYVGGR is very good. So I get them to do 2 of those. With those formulas, these Mr. Happy formula, they have to take 2 twice a day on an empty stomach. And that's a very important factor.
And
then they may not need a PD5 inhibitor.
And what does that product have in it?
Yeah. So it has it's 5 ingredients at a very high dosage. It has L-citrulline, which L-citrulline makes more arginine in the body than just taking arginine by itself.
Right.
It has epimedium. Epimedium has a chemical in it called icarin, ICARRIN. Icarin is actually a PD5 inhibitor, just like Viagra, Cialis, and Levitra.
And
so
arginine helps with
in epimedium.
And arginine helps with nitric oxide production, right?
Correct. So eventually what you want is your blood vessels to open up. Arginine helps with that. So your arginine helps stimulates the inside of the arteries to produce nitric oxide, and then your vessels open up. How you get more arginine in your body, you could eat arginine or drink supplements, but you have a lot of arginase in your system that breaks it down very quickly. So you have to take, studies have shown that arginine works at about 5 grams a day, but you have to break that up to has shown to actually make more arginine in the body than just taking arginine. So it's always my preference when I'm trying to raise arginine levels. And there was one randomized trial that showed that it helped with sexual erections, specifically with citrulline.
Okay.
Epimedium or horny goatweed, it's the other herb. It's called the layman's term is horny goatweed.
Right.
It actually has icarin, which is like a PD5 inhibitor, very good. The other is you want adaptogens in the system. Adaptogenic herbs. This is a group of category of herbs that kind of, like the name implies, it helps your body adapt. So adaptogenic herbs are very important. The one in Mr. Happy is rhodiola, and it's one of my favorite. But then you have ashwagandha and you have Siberian ginseng. Those are good too. I have to say those are not in the formula. And the reason why they're not is because I like the studies in rhodiola, not so much in relation to sexual health, but in relation to extra energy that you would get after a long day's work per se. So that one of the problems that men have is that they work all day and then they're pooped out at the end of the night. Well, we're trying to avoid that. And rhodiola is the best type of herb adaptogen for that.
So if you have a man who has decent total testosterone levels, but the free testosterone is low, that means too much is being bound up by like sex hormone binding globulin. Are there specific nutrients that can help with that issue?
Yeah, so there are 2 things. A low protein diet it's a contributing factor to high SHBG. So a low protein diet. So vegans sometimes have high sex binding globulin hormones. And I use nettle root. I don't use it in a formula because I use high dosage of nettle root, up to 500 milligrams twice a day of nettle root, not nettle leaf. And so these things are all very important.
Is that the same thing as stinging nettle?
It's the same thing as nettles, but sometimes you see nettles and there's nettle leaf.
Okay.
And we don't want nettle leaf for this particular purpose. We need the root.
Okay.
So nettle root is what's important to kind of inhibit overproduction of sex hormone binding globulins. And
so use capsules or tincture?
I use capsules for the most part. And I use about 500 milligrams. It's high dosages and only nettle root, not in a mixed formula. I keep emphasizing that because then if you use a formula, and I'm okay with formulas, but not for this particular purpose, then the dosage will be too low, and the dosage needs to be high for this particular purpose.
You have a favorite manufacturer for that product?
Yeah, I like MediHerb. First of all, for herbal products, I like MediHerb.
Okay.
I'm a big fan of MediHerb. So that's the main one, and I like I also use Gaia sometimes.
Okay.
GAIA.
Yes.
Yeah.
Okay, cool.
Yeah.
What if they have excess estrogen?
Mm-hmm.
That
Great question. Yeah. So there are no there's not such a thing as bad chemicals or bad hormones in men. I think we get very caught up with the problem with cholesterol.
Sure.
Let me say this before I answer your question, because my mind is going somewhere else briefly. As I mentioned, cholesterol. I saw a patient I posted on Facebook with 101 total cholesterol level and very low testosterone. 101 without being on a statin. I've never seen that before.
Wow.
I've never seen 101 cholesterol in a man that's not on a statin.
Right.
So it is unusual. And so this guy's not making any of his hormones, right? His hormones are low. So as a result, that's throwing things off. So my point with that is that there's, we used to think, and of course forever, cholesterol is bad. Cholesterol is bad. Cortisol is bad. Estrogen is bad in men. We don't want any estrogen in men. That's not true. Estrogen is a very important hormone in men. And studies have shown that men that have levels of estrogen, estradiol, between 10 and 20 nanograms per milliliter actually have lower heart disease. So I like men to have between 10 and 20, not higher than 20,
right.
Or certainly not lower.
I know a lot of the labs say it's normal until 40, but I agree with you. I think 20 is probably a better cutoff.
Yeah, you know what we do. We optimize our ranges is what we do as functional medicine doctors.
Yeah.
And that's the number. And this is based on research. This is not my opinion.
No, I know you're always based on research.
Yeah. So that's what I like my men to be. So yeah, we look at estrogen levels, and so if it's over, sometimes it's over 20 or 30 or
right.
40, 40.
What do you do in those cases?
What we do is liver detox, get them away from, my vegans are sometimes very high in estrogen because they start, they're probably eating too much soy products. So I get them to lower down their soy intake. And I do liver type of detoxification. I use a lot of dim and broccoli type of extracts.
Right.
Milk thistle. Get them on a good detox and just kind of get their bodies normalized. Typically, if you reduce the estrogenic foods and just clean their liver.
Yeah. Good. Cool.
Yeah.
So we know that low testosterone or erectile dysfunction is actually a side effect of a lot of medications. What medications do you find are the most common culprits in this regard?
So many of the high blood pressure medications are a problem, like beta blockers. So beta blockers contribute to erectile dysfunction. Some H2 blockers for acid reflux, like Tagamet, interferes with the production of testosterone.
And those are among the most commonly prescribed medications.
You better believe it. Yep, you better believe it. Statins, sometimes they lower cholesterol way too low, and so the patient is not making enough cholesterol to make their steroid hormones, their reproductive hormones. So statins can be an issue.
By the way, you mentioned a patient with low cholesterol. What do you do with the patient with low cholesterol? You actually have them. What do you do to try to increase their cholesterol? I heard of a product from sheep's skin or something, some cholesterol product that one doctor said she used.
Yeah, I'm not familiar with that. I'm familiar with, so I'll tell you what I do in general, and then I'll tell you what I do with what I'll do with this patient, because they're two different things. This
Okay.
patient is 51 and he has concerns about prostate cancer. So he's doing a lot of things from an anti-prostate cancer perspective. A lot of that is being vegan and eating soy products,
I see.
which I never put him on that diet for prostate cancer prevention. So one of the things, so he loves meat, and so one of the things we're going to do is, go. And he's a blood type O, and I think O's can handle. They do better with, eating, grass-fed beef and animal products. So I'm going to get him to eat animal products again. I'm going to get him off all that soy. I'm going to get him to focus on big muscles and train big muscles, less repetitions, not high reps, more weight. And that's another way of increasing testosterone. I'm going to get him to do weight resistant exercise on a fasting state. So that's interesting because that also helps increase testosterone at a fast. So no pre-workout anything to drink.
Oh, really? Huh. That's interesting.
So then a protein drink with creatine, because I think that's what he wants after his workout.
Really? Don't you want to take creatine before?
And so for the purpose of testosterone, I'm a big fan of lifting, weight resistant on a fasting state, only water. Creatine can give you that extra push,
Right.
and that extra, creatine to help you get that extra lift.
Right.
But it has a pretty decent lifetime, and I'll get him to take it, hours before or the night before. I know creatine can help for certain people who, for example, if you have normal testosterone, creatine as a pre-workout is fine. But for guys that I'm trying to raise their T levels and their free T, I get them to just do, on an empty stomach with no macronutrients in their system at all.
Interesting.
Yeah. So with regards to supplementation, I use herbs. I use fenugreek. That's been studied quite extensively. Testofen is what's used. I use maca, and again, when it comes to maca, I use only maca, 3 grams a day. So I don't mix it with anything else. I use XY Vigor or something like Mr. Happy. So what I've noticed in my patients that use XY Vigor is the practitioner line for Mr. Happy, by the way. So the formula is the same thing. So I may use the names interchangeably as we talk.
I see. Why do you take the maca by itself? Is it different if you mix it with other products or foods?
I take it by itself because you need 3 grams for it to have any efficacy. And that's you can only fit so much into a capsule. That's the only reason.
Right.
Yeah. The other adaptogen that has actually been shown in studies to help increase testosterone is ashwagandha. So between ashwagandha, fenugreek, and maca, that's my main 3 herbal combination. It's not tribulus.
Okay.
It's not tribulus because I know a lot of people are, taking tribulus, and I don't see it. I just don't know the evidence for it. I don't see it, and I don't see it clinically.
Okay. Interesting.
So, yeah. And then I get them to, I figure out their sleep patterns, and if that's a problem, we work on that.
Okay. What do you
As
think
you
of,
know, sorry to interrupt, Ben. As you know, we make most of our testosterone during our sleep cycle, anywhere between, 4 to 5 in the morning.
so is it crucial when we test testosterone that we test it pretty early in the morning?
It is, particularly on younger men, younger than 50. Older men, older than 50, studies actually show that it doesn't matter because their testosterone is pretty leveled off throughout the day.
Oh, I
So
thought
I don't
I thought
know,
that older man category started at 70.
well, I want to think that too, by the way. As you see, my face is graying by the day. When they talk about older men and younger men, I take that a little bit with a grain of salt, because a 60-year-old man is not a 60-year-old man. You could be a 60-year-old man who's like 70 biologically, or who's 40 biologically.
Right.
So I'm very careful with that. I'm just a messenger here.
What do you think about marijuana and testosterone levels? And
What's
especially since
testosterone? Oh,
marijuana,
sorry. Marijuana.
yeah, it's getting more popular, and even CBD
Yeah.
oil, and it seems to be a very hot topic right now.
Right. So marijuana lowers testosterone levels. And so men want to be careful. Is there a toxicity to the dose? I don't know. I don't know if you smoke 2 joints versus 1, if there's a difference. Same with alcohol. Alcohol in excess it can be an erection killer. A little bit of alcohol can take the edge off and can help you get into the mood. So there's a fine line. I don't know if there's a fine line with marijuana. I think men want to be very careful, but I do know that it lowers testosterone level. So men want to be very careful with the usage of marijuana. I know it's now the in thing, and there's a big, it's big industry now. And I think Snoop Dogg is, a partner in one of these marijuana companies, and everything is big business. But I think men want to be careful if they want to keep their testosterone levels high.
What about adrenal fatigue? And I know DHEA, which is produced by the adrenals, is a precursor to testosterone.
Yeah. Yeah. So that's very good. So DHEA has shown to help with erections as well in men who are deficient in DHEA. In men who have no deficiencies in DHEA, I would not give DHEA for that particular purpose anyway. Okay. If there is a deficiency in DHEAS, then you would want to give DHEA, and that may help as well with erections. Yeah.
Yeah, I was on some discussion about sexual issues with women, and women are using a bunch of topicals, including a topical DHEA cream now. Are there topical creams like that? Does that have any effect for men? I'm just curious.
Not that I know of, and not from an erection perspective.
Right.
That I know of anyway.
Okay. So I've heard of a few patients who had scar tissue in their penis from riding a bike or other trauma. Can you talk about that as having an effect on erectile problems?
Well, I don't know if these particular patients you're referring to, if they've had Peyronie's disease, that with scar tissue, their penis bends a little bit and becomes like a curve. It curves. If there is Peyronie's, there can be erectile dysfunction. There's like 3 levels of Peyronie's. If they have like level 1, they may just see a slight curvature, upward or sideways. And that's not, if they have a level 1, it doesn't interfere with intercourse at all. If they have a level 2 or 3, they may have erectile dysfunction from that. A little bit harder to treat. The natural approach is very, very extensive. It's very difficult. I have not been that successful, I have to say, with Peyronie's disease. just with natural methods alone anyway. So that's very difficult to treat. So any other type of trauma, not so much from bike riding. I mean, it depends. If they have prostatitis and maybe prostatitis or inflammation of the prostate, and that can contribute to erectile dysfunction, because now the nerves that are going to the penis are, irritated and inflamed as well.
Well, I've also had some of those bike riders tell me about just numbness in that whole area too. So I suspect that could potentially be a problem. That's
neurological for sure.
Yeah. There are some physical treatments for erectile dysfunction. I was listening to one of Mike Mutzel's podcasts, and he had this Dr. Catherine Retzler on, who's a naturopathic doctor. And she mentioned, number one, giving PRP injections into the penis. And she also talked about Gaines wave sound therapy. What have you know anything about those two?
Yes, I don't do them, and not because I'm not interested. It's because I can only do so much.
Sure.
I know that PRP is used for Peyronie's disease, that curvature of the penis, with some level of success. So that with sound wave therapy, I've heard anecdotally good things. Ben Greenfield, who actually we met at Mindshare, he was at Mindshare.
Yeah, I met him as well.
He's like a guinea pig with all kinds of things, and he's reported to do that with his penis without having to. He didn't have a problem. He just wanted to do it, and he's openly talked about it, and he talks positively about it, that his organ is bigger, at least to him, and that it works. There's a stronger orgasm when he has intercourse, and then indeed, it helps with longer erections. So there's a lot of anecdotal information. There's a big to do the PRP and the sound wave. Quite frankly, I think it's a little bit. I like to see some objective evidence before I send a patient to do that. I would send a patient to do PRP for Peyronie's just because there's not much out there to begin with. So, for that purpose, I would. But I'm still waiting for a little bit more data or something for me to hang on to, so I can say with low level of concern for them to move forward with a patient to move forward with that.
Are there any nutritional deficiencies that you think can cause erectile dysfunction or play a role in that issue? Yeah,
so guys that are with low protein diets, because they don't have enough arginine in their system, that's a concern. So some sort of amino acid deficiency, like arginine, and once again, zinc is a major male mineral. I would other than magnesium, which magnesium obviously it's involved in many biological pathways and is probably the number one mineral. Other than that, for a man, zinc is a man's best friend. And antioxidants, because there's a lot of much of erectile dysfunction and male infertility can be due to oxidative stress. And so you need a fine combination of antioxidants, and the deal. Alpha lipoic acid, vitamin C, mixed tocopherols, vitamin E. All those are all very good. And plant-based phytochemical antioxidants as well.
Is there an upper limit to zinc supplementation that you don't like to not go above?
Great question. I hang around 30 to 60.
Okay.
Which is fine. Anywhere I try not to go. I never go above 60 or anywhere near 100. With any mineral, too much of a good thing may not be such a good thing. Zinc is one of them, and of course, zinc and copper they work together. So once you start giving more than 30 to 60 milligrams of zinc, you may want to give 1 or 2 milligrams of copper so that you don't have a copper deficiency. So I don't go higher than 60 milligrams.
Okay.
On zinc.
And one last issue I'd like to touch on, because I don't think it would be complete to talk about this topic without mentioning some of the psychological issues like depression, stress, relationship problems, and even watching porn, which seems to be a problem.
Yeah. So adrenaline is the biggest erection killer in the world.
Stress.
So there is no strong chemical. Any type of stress or anxiety or guilt or anything like that will cause the production of adrenaline, norepinephrine, and epinephrine. And there's no chemical that I can inject in your body that's stronger as an erection killer than these adrenaline chemicals. Okay, so that's one big takeaway.
Cool.
Now, with that comes, the relationship, the importance of how you get along. There are times where people saying, guys come in my office and saying, "Well, I have erectile dysfunction." I was like, "Well, how do you know? What if I don't know. What if I bring J-Lo into the office? Would you have erectile dysfunction?" Well, I don't think so. So sometimes you can see there's problems in their relationship. Do you still think that your woman, if it's a woman, do you still think she's hot, and all these factors? Now, these things are overlooked all the times, but if we're trying to address the underlying cause, then that needs to be addressed. And so, how often do you wake up with an erection? And then I do give them like some Cialis, even if they're not functioning, to see if they get more spontaneous erections. If they do, that means it's psychological. If they get an erection from anything, from a drug or a supplement, that means that it's psychological. So I cannot overestimate the importance of just a good relationship, and we can have another podcast on what that would look like.
Right.
The other aspect is porn. You mentioned some statistics initially that about 30% in men under 40 roughly have ED. I would argue that what I see is a whole lot more than that in men under 40.
Okay.
And the reason for that is because the men under 40, particularly millennials, have had free access or paid access, at easy access to porn since they were probably born. Well, not since they had access to it, but they, because they've been around iPads and so forth. Looking at porn, and they having this perception of what sexual intimacy is like. Then once they start having intercourse or they start mating, then they think that that's what it looks like, and they are having a lot of erectile dysfunction issues. When you and I, Ben, you look nice. You look like a millennial, but I know you're not.
No, I'll be 60 this year.
Whoa, you're a milestone, Ben. That's amazing, actually. I think I'll have to interview you sometime soon to figure out what you're doing.
Sounds good.
Jeez.
Thank you.
So if you or I, right?
When I finish my anti-aging book, you can interview me.
Absolutely. Would gladly do so.
Okay.
When you or I wanted to get a porn flick, we had a VCR. We had to go to the store, go to the corner store, which was in this isolated section, nice and big. You see triple X. It's a little bit embarrassing, right? To go in there. So we didn't watch much porn relative to what's available now growing up. So these young guys are more screwed up in bed than ever before.
Right.
And a lot of it has to do with excessive porn watching. It's not my opinion. and is an absolute fact, and it's been proven and confirmed in scientific studies. It's bad. It's a problem. And briefly, I'll say this: why is it a problem? Many reasons. They are watching positions and things that once they start mating with females or whatever, or whoever, they may not do all those positions that are so, wild and so forth. The other thing is that they all think they have a small penis. Part of the reason why they think they have a small penis is because watching porn,
right? Which
is magnifying the size of the penis, and sometimes they're holding it and inserting it at the same time, and they're thinking that they can do that. And well, I can't do that. If I hold it, I can't insert it. There's not that much left, right? So all these issues, I'm serious. I speak to these guys all the time, and they're thinking that they could do all these things, and they can't. Almost at least 5 times a week, a guy comes into my office and says, I think I have prostatitis. I think I have prostate. I'm urinating a lot, and I think I have a small penis. I think I have microphallus. Now, microphallus is a real diagnosis. That's a real diagnosis, right? I've met one guy in my lifetime that has microphallus. In my lifetime, I've been practicing now for 13 years, mostly men. Once have I seen them. Microphallus is just the glands, only the head of the penis, and that's all they have.
Okay.
So most guys are not, they don't have a small a penis. Yeah, some guys are bigger than others, but most guys don't have microphallus. In any event, watching porn, I think, is one of the biggest, no pun intended, contributing factors to erectile dysfunction amongst young men.
Great, Dr. Geo Espinosa. This was a lot of great information. And for those listening or watching this podcast, how can they get a hold of you?
Thank you so much. So my website is drgeo.com, drgeo.com, E for erections, not I. And the book that just came out, Integrative Sexual Health, that I'm one of 3 editors.
Okay.
We were talking about before, Ben, you almost don't feel when you're done with it that you have a good book out. That's been I've written several books, and at the end, I'm like, God, I could have done more. And then you read it, and then it's like, oh, wow, yeah. It's almost like you're reading somebody else's book. This particular book, Integrative and Sexual Health, along with my co-editors, Barbara Bartlick and Janet Mendez, it's probably, not probably, because I have many books behind me on sexuality. It is the most comprehensive book on integrative and functional medicine for sexual health, both for male and female. I actually learned tons from a female perspective because we got all kinds of expert authors to contribute. And quite frankly, I know very little about female sexuality, which I think it's important for men to know, actually, in order to, if you're going to have intimacy with females. In any event, Integrative Sexual Health, it's out now. It's part of the Wild Integrative Medicine Library of books. And
Cool.
It's a great resource. So thank you for allowing me to mention it to your audience.
Absolutely. And I'll put a link to it on my webpage and add it to the YouTube page as well.
Thank you.
Okay. Talk to you soon.
Thank you very much.
Thank you. Thank you.